Today, we will be conducting the proper way of assisting geriatrics shower bath. The purpose of this is to avoid contaminating the patient from any microorganisms and to make the patient comfortable. Next, we have to gather all the necessary equipment to facilitate smooth carrying out of the procedure. The materials are bath towels, shampoo and soap, towelette, grooming kit, new set of gown, thermometer, chair with backrest, toothbrush and toothpaste, and lastly, no skid rubber mat. Before starting the procedure, make sure to check the patient's profile to know the previous diagnosis of the patient. Next, proceed to the patient's room, knock on the door for courtesy, and make sure to greet your patients cheerfully. If the patient is unconscious, gently tap his or her foot to wake them up. If he or she is awake, assess the readiness of the patient and explain the procedure. Also, inform the patient that he or she has to attend his or her personal needs and ask the patient what does he or she prefer, if shower bath or tub bath. Next, check the patient's body temperature, or you can also check the vital signs of the patient. But before checking the patient's temperature, make sure to disinfect the thermometer from bulb to stem. While waiting for the result, check the proper room ventilation. Make sure that there is an adequate lighting to see and to avoid further accident. If the patient has normal temperature, proceed to the shower bath and make sure to disinfect the thermometer after getting the result. But if the patient has fever, do not proceed on the shower bath. Give the patient a tepid sponge bath instead. Next, proceed to the bathroom and prepare the materials needed. Test the shower function, check the water temperature. You can also use a shower heater if there's available in the bathroom. Place the rubber mat on the shower floor. And stool chair over the rubber mat. Through body mechanics, it promotes safeties not only on the caregiver but also on the patient during movements. If the patient is showering independently, check the patient within or after 10 to 15 minutes to avoid causing vasodilation and pooling blood, which can cause dizziness. Help the patient into the tub, providing necessary assistance, and gently position the patient to provide safety and to avoid further accident. While waiting the patient to finish, you may prepare the food and prescribe oral medication to be taken. Once the patient is done bathing, turn off the shower and offer bath blanket to cover herself. Ask the patient to sit on the chair outside the shower room and assist the patient to pat dry the body and head as well, also in dressing and grooming. Go back to the shower room and clean it according to the agency policy. Discard the soiled linens, Place an occupied sign outside the door and return the articles to the proper places to maintain cleanliness and good infection control practices. Once the patient is done, assist the patient going back to the room and provide new sets of clothes and hospital gown. Make sure to check the patient's body temperature after you assist the patient in dressing. While waiting for the result, do the grooming, comb the patient's hair, and make sure to ask the patient if he or she is allergic to any form of skincare before applying lotion, powder, or lip balm. Don't forget to check the patient's fingernails and trim them if they are long. Also, ask the patient if he or she would like to do his or her oral care. Check also the patient's mouth for some mouth infection. In serving prescribed oral medication, make sure to check the manufacturing date and also the expiration date of each medicine. For the tablets, pills, and capsules, make sure to read the label. Likewise, in preparation of liquid medicine, read the label, shake the bottle, open the cap, and pour the medicine. Medication should always be given on time. Next, assist the patient on taking food. But before you serve the hot food, inform the patient. Make sure the food is prescribed by the dietitian. If the patient is done eating, do the aftercare immediately. Make sure to always wash your hands and the aftercare techniques. Help the patient into the tub, providing necessary assistance, and gently position the patient to provide safety and to avoid further accident. When the patient is ready to excrete, assist the patient to sit on the commode chair. You can also offer a bedpan for the bedridden patient. Don't forget to do the perineal care or to clean the genital area. In collection of urine specimen, make sure to prepare all the materials needed. Before doing the specimen collection, make sure to wash your hands and wear your gloves to protect you from the risk of contamination. Next, put the patient back to the bed. Once the patient is done excreting, use spatula to obtain stool specimen. Before proceeding to the procedure, make sure to wash your hands and wear your gloves to protect you from contamination. Start collecting the urine. Do not collect the first drop of urine. This may be contaminated, and make sure to collect the midstream urine for about 3 to 5 cc. Next, close the specimen bottle tightly and don't forget to discard the remaining stool into the toilet bowl and do the aftercare immediately. Remove your gloves, wash your hands properly, and document the procedure. Send labeled specimen to laboratory with proper filled up laboratory request form.